Hi, I'm Beth Dean, the CEO of CURE Epilepsy. First, let me say what an honor it has been to have participated in this most recent cohort of LeadersLink participants. I'm grateful for the opportunity to have the support of the Milken Institute and access to their vast network of resources as our organization looked into the promise of harnessing patient data and what CURE Epilepsy's role should be. Epilepsy is a neurological disorder characterized by recurrent unprovoked seizures. Epilepsy is a diverse condition, and there are many different types of epileptic seizures and epilepsy syndromes. People with epilepsy can be impacted cognitively, functionally, and psychosocially. The causes of epilepsy can also vary. Some people have a genetic predisposition to epilepsy, while others may develop it as a result of brain injury, infections, tumors, or other medical conditions. In some cases, the cause may be unknown. CURE Epilepsy is the leading non-governmental agency fully committed to funding research in epilepsy. Our organization was founded 25 years ago by Susan Axelrod and a group of mothers of children with epilepsy who were frustrated with their inability to protect their children from seizures and the side effects. They decided that living well with epilepsy was not good enough, and to that end, we have raised over $90 million and awarded more than 285 research grants in 18 countries worldwide. I was interested in participating in this cycle of the LeadersLink program because we've had many conversations with our community about the promise of patient data, whether it's from EHRs, natural history databases, or patient registries. Knowing that there's been much discussion in our community about the power of patient data, CURE Epilepsy was very interested in determining if this is a place where we could support and contribute in order to improve outcomes and get to cures faster. This was the foundation of my LeadersLink project. Is there an unmet need in the epilepsy community around patient data that CURE Epilepsy could or should fill? I spent the initial part of my project assessing what different patient data sources existed in our community and who specifically they were serving. Because of the multitude of types of epilepsy and epilepsy syndromes, our patient advocacy space is very fragmented. There are many sources of patient data, from registries to natural history databases to learning healthcare systems. Many of the data sources serve a particular monogenic epilepsy or syndrome that is represented by an advocacy group, but there are larger data sources that also pull from EHRs and have data from all patients with epilepsy. Understanding that there are so many data sources that already exist meant that there was no substantial need for CURE Epilepsy to recreate any of these. As I thought about this a little more, I did have an idea that tied into some existing work that we were doing. There are still some epilepsy syndromes that are not represented by an advocacy group. We've started to work with one of these disorders, Jeavons syndrome. They have a Facebook group for individuals and caregivers, but no one is advocating for research and cures for this disorder. It got me thinking, could we raise awareness and drive research if there was an established set of data for researchers to mine? After more than a dozen interviews with contacts at RareX, Invitae, advocacy groups, and others, I better understood the options for collecting patient data. Each partner that I spoke with had a different perspective, which allowed me to understand and evaluate what would work best for our scenario. Some advocated the importance of owning your own data. Some advocated for wide and free access to the data, and some emphasized simplicity in order to facilitate participation by the people affected. Ultimately, after weighing the different options, I landed on a solution for our organization that will work by collecting data for this particular rare epilepsy. We are going to partner with both Citizen and RareX to collect data for the Jeavons community. This will ensure that a contact registry is available. There'll be EHRs and patient history to mine. It also works for us because the burden will not rely solely upon CURE Epilepsy to manage the resources, as we don't have the capacity to do so. I'm still working on the logistics of how we're going to launch this to community and whether we'll do both databases in parallel or in sequence. But I look forward to launching this initiative in the first half of 2024. I'm incredibly grateful to Faster Cures and the LeadersLink program for their support during the past 2 years. It was wonderful to have access to their vast network of resources to identify unmet needs within our community and develop a plan to collect patient data for groups that will benefit from this activity.